Well, since you mentioned the testosterone, so are there like any modern and also maybe like holistic treatments to help men with the testosterone level?
Well, the best, again, I mentioned this before, which is weight loss. I mean, the number one reason for people to have low T, through all their life is just having extra fat around their body. If you have extra fat around your body, fat breaks down the testosterone into estrogen. So a lot of the people who are heavier, have a lot of fat on them, tend to have higher levels of estrogen and lower levels of testosterone because the testosterone gets broken down into estrogen. So actually, testosterone gets made from estrogen and then gets broken down back into estrogen. So our body is very cool because, men tend to have uh, testicles that produce extra testosterone for men. Women don't have testicles, therefore, their testosterone levels are much, much lower, usually 10 times lower than man's level. And so, men have to maintain their testosterone production throughout life, and that's what actually kind of fails them towards the mid 40s to 50s. Most men after the age of 50 do need some form of kind of replacement, I think.
So basically around like 40, 40 plus, if the man starts experiencing the decrease in testosterone, so it's possible to get a prescription and get a testosterone replacement
Well,
therapy.
yeah, what when you say holistic, I mean, the way my thinking on holistic is that we don't put, the drugs we put in are essentially replacements of our own testosterone. So, whatever we do to replace your testosterone, there's multiple ways. There's a 4 month shot, there's a 1 month shot, there's a 3 month shot, there's a daily kind of like cream that you could put on. And the kind of the best one for people who want to maintain their fertility is an actual like a nose cream. We put it in the nose 2 to 3 times a day, and that maintains your natural levels of hormones and it maintains your fertility. A lot of times, one of the problems with replacement is we keep getting the levels too high and it drops natural production as well as lowers fertility. Now, a lot of men after the age of 50 don't mind that because they don't want to have any more
Mhm.
kids, which makes a lot of sense and therefore doesn't really matter as much. But there's other ways to maintain fertility even on injections, such as there's kind of Clomid that we can add towards testosterone that can maintain natural production of testosterone as well as maintain fertility.
Oh, super interesting. So, but talking about the treatments for low testosterone, like the most holistic one is a fitness, right? And if it's a
Well, yeah,
fitness
I mean,
doesn't help, so
I
then
always recommend the most I always recommend the most holistic, but it's not the fastest one because what normally happens is it normally takes 3 to 4 weeks, 3 to 4 months for just the weight to come off, and then you normally takes 3 to 4 months for the hormones to get kind of back up to normal.
interesting. Um, what about like sexual health? So I've heard that there are like a lot of like fit like gentlemen around there, but from like our doctors network, they say that there is a problem nowadays that sometimes you can see someone who's very very fit, but they still suffer from low T.
Exactly. So, erectile dysfunction is a very big problem with people with low T. It could also be with people who have normal testosterone. And erectile dysfunction happens where, if, like, say you have some heart conditions, say you have a high cholesterol, say we haven't been treating a lot of these conditions, or high blood pressure even. Blood pressure affects erectile dysfunction. Diabetes, strongly affects erectile function. Um, and so blood pressure, diabetes, weight, testosterone, and coronary artery disease. So if your heart's not working well, it's going to affect your erections as well. So we check for all these conditions. So if someone comes in for erectile dysfunction, we check their hormones, we check their blood work for lipids. We check their blood pressure. We go over their medication, make sure that the blood pressure meds are controlling whatever is going on. And so that's why I'm saying like the integrated approach, it's more holistic than what a typical urologist does, which is okay, we're gonna just prescribe Viagra or Cialis. Viagra, Cialis are great medicines, but you want to rule out problems with your heart. You want to rule out problems like the what is causing your erectile dysfunction. If we could find out the cause, we could stop it, we could reverse it, we could treat whatever the problems are, and kind of start helping much, much better than, say, Viagra or Cialis, which is a band-aid in these situations where there's an actual, a real problem that could be easily cured.
What is the most, I would say, common problem around, like young males?
The biggest problem with young males is some of it could be due to just, 80% of sex is mental. So, I think a lot of young males are used to watching too much porn. I think porn is good in moderation. As soon as we start watching kind of huge amounts of porn, that affects our ability to have sex in the real world because obviously, masturbation is healthy, but again, shouldn't be really done in large doses and, can affect normal erection function, just depending on every male has their kind of right level of sexuality. Some men want to have sex 4 times a day, in which case, porn is probably okay. And other men want to have sex once a week, in which case, porn is probably not advised in those situations. So a lot of it is also like, okay, what kind of where am I, in terms of my, kind of desire for sex, and that could be affected by testosterone, that could be affected by like depression, it could be affected by a lot of other things. But still it is important to know where you are on that scale. And just because you wanted sex like 3 times a day when you were in your 20s, that could change when you're in your 50s, and therefore the masturbation schedule must either be going down or up, just depending on where you are and what your kind of sexual desire needs are. I
Interesting.
mean, I have a lot of patients in their 80s that want sex 3, 4 times a day. In which case, they use porn to kind of supplement, their normal sex because their wives or partners can't do it that much. So, they need to have some supplementation.
Interesting. You during the event you gave a very interesting advice. I think a lot of people really appreciated it about keep doing, like otherwise like you will lose it, right? So
Yeah, I mean, I think the critical aspect of sexuality is you have to continue to, use it. A lot of people say, okay, well, my partner's not in the picture anymore, or she went away, or she's sick, so I'm not going to be having sex. And that's very, again, when I say that, sex could be masturbation, that hurts nobody, in my opinion. I mean, I think obviously, that just helps maintain your kind of natural levels of all the different things that you need. I mean, there's a lot of things that we don't know about, but mentality wise, brain function wise, we really have to, as with anything, if we're out of practice, it's going to be hard to regain kind of the ability to do something once you stop doing it for a decent amount of time. I tell people that they should have sex at least every other day. And what I mean by sex is, I mean, for men, ejaculation, and for women, orgasm, So I would say, again, masturbation is a great way to kind of simulate sex, which is fine. I mean, obviously, real sex is probably better than, um, from a kind of like overall perspective, from your mentality wise, for relationships, for your kind of mental health. Real sex is way better, in my opinion, than just masturbation. But in this, in our society, we cannot have real sex all the time for a lot of different reasons, and therefore, masturbation, I think, helps supplement for when it's needed, and it's not just for men. Obviously, masturbation is for men and women,
mm, interesting.
which a lot of times, women look at it as a male thing, and I don't think it should be a male thing. And for women, it's even more important because I know a lot of women tend to have a lot less sex than men do, and you know, that doesn't mean they shouldn't be having orgasms because I feel like the orgasms can maintain their kind of desire for sex, maintain their need for sex, maintain their natural levels of all the different hormones, and of course their brain function. There's a lot of brain level, like serotonin levels in the brain, pleasure receptors in the brain, pheromones receptors in the brain all have to be stimulated. And if you're not doing that on a regular basis, a lot of women lose interest in sex. And when they lose interest in sex, men lose interest in them because, obviously men are looking for sex. Women lose interest, have a kind of a decreased ability to attract those men in a lot of different ways, just chemistry, pheromones, just the way they approach men, everything changes if their desire for sex is like way down, and that really is hard for most women to overcome. And if their desire for sex is way down, then what's the point of even having a partner in their life, so again, it's important to kind of keep that desire, keep the ability. A lot of times I recommend that women also get some kind of bioidentical hormones to get their level of kind of like sexuality to come up, especially if you're having problems with that. There's a lot of, like I would say, gynecologists out there that are very into this kind of field where, it's just, not just because you speak to your regular gynecologist and he or she, they say, for example, oh, that's fine, that's normal. It is not normal. It is not fine. There are plenty of gynecologists and other doctors out there that will do bioidentical hormone replacement. Not every doctor knows what they're doing there, and that's an important thing to understand. Another point I wanted to bring up is, okay, when I say I'm a modern urologist, what does that mean? What is that? Typically when you go to a doctor, like say a urologist typically puts a finger inside of a guy's, kind of anal area, doesn't feel very much, doesn't tell us very much, and makes a diagnosis that most of the time is wrong, And so I completely do not do any finger rectal exams. I don't think that should ever be done on any patients ever. Anything that a finger could feel, you could see, or you could put an ultrasound in. You don't have to put a finger in. But we could put an ultrasound in. We could find out the exact size. We could find out any masses. We could find out like 10 different things that a finger will never be able to tell us. And a finger is just wasteful. And most patients never want to come back to a urologist after the finger exam for good
Yeah,
reason because it's not
it's
comfortable and it's
intimidating.
not needed. And it's not needed either. So it's a very bad test, in my opinion. I don't think we should ever do it. And there's a lot better tests out there. Like I said, the high tech ones are blood, urine, ultrasounds. Typically, if you go to a hospital urology practice, you will never get any of these things because they're only looking for big surgical things. They're not looking for ways of preventing people from developing worse problems. So again, I recommend that you see a modern high-tech urologist, not just, oh, this urologist did a finger exam, said I'm fine, didn't check anything else. I don't know how they were able to say patients are fine, which is a finger exam, and a discussion where they're basically prescribing some medicine like here or there to cover up some problem, but not actually doing a treatment for it.
Interesting. Well, thank you so much.
And that goes, and by the way, that goes for all other fields. So if you go to a gynecologist and there's like, don't worry about, if you go into the bathroom all the time, don't worry about it. Just suck it up. I mean, that's not a great idea. Or if they're just like, I'm too busy to deal with it, you really need a specialist. And the same with like, if you go to a gynecologist and you say, look, my sex drive is low, and they're like, okay, well, you're like 30 years old, and that's what happens when you get 30. I mean, that's not the best response. I would say about 50% of gynecologists out there would just blow that off as if it's completely normal and okay. And I don't think it is. So I'm not trying to criticize, but some doctors are on things and other doctors are just simply like, looking for big surgical cases or looking for the big payday. I mean, I don't think that's how medicine should be practiced, but
Yeah, no, I agree. Well, thank you so much.
now I'm not saying all doctors, obviously.
Yeah,
I'm saying people get a sense. You will, I'm just giving kind of extreme examples so that people understand
yeah,
what I'm
absolutely,
talking about.
absolutely. Yeah. Well, thank you so much, David. This was very, very interesting.
Thank you.
Yeah,
Thank you for
thank you.
having me on. I love your longevity events. You always do such a great job with that, and I
Thank
think
you.
it really helps a lot of people out there. And I think a lot of like the companies that are innovating, that are doing amazing work for longevity, should be, put out there and allowed to kind of tell their story because like we were talking about earlier, that there are some doctors that are just into the high tech cutting edge, and other doctors that we never learned this in residency. So during our training, when we don't learn something, we have to do these longevity events or at least know of these longevity products.
Yeah, that's true.
And a lot of it could be patient oriented because once a patient hears about it, then they're going to tell their doctor, like, why are you doing a finger exam on me? I don't need a finger. Like, why don't we do an ultrasound instead? Like, where's your ultrasound machine? And that's what I think my role is to help with patient understanding of what should be done. And patients should be smart right now. Shouldn't only rely on, okay, my urologist knows everything and I don't need to know anything.
Yeah,
I think,
absolutely.
that's a good approach before we had all these ways of disseminating
Education,
information.
education. Yeah, educations.
Now we have, yeah, now we have a lot of better educational kind of content out there where patients could learn about this stuff.
Perfect, perfect.